Oh, hello, welcome to my special test video for the lumbosacral aspect of the practical. The very first thing that we will be working on is Leseg's straight leg raise. So I'm going to have Chappie lay back. I'm going to bring his leg up. If he has pain with that, then I'm going to dorsiflex. If he has pain with that again, those are both positive signs for a herniated disc, SI, sciatic nerve irritation type of thing. Then we'll also do the well straight leg raise. If he has pain on this right side, we're going to lift his left leg up actively. So go ahead and bring your leg up. Whenever he would elicit pain, if it is down the back posterior side of his leg on the right side, that would be a positive sign for, once again, the nerve root impingement. Prone knee bending. We'll have him go like that. And then what you're going to do is push this knee back like that. If he has any pain back in the hip, that would be a positive sign for an L2 or L3 nerve root lesion. Now we have slump test. If you don't mind going this way. We're going to go ahead and have the patient slump his shoulders back, and then we'll flex his neck, and then we'll have the patient extend his knee. Watch out. Push it. And then we'll have him dorsiflex as well. And then if he has pain with that, that'd be a positive sign for sciatic pain with the radicular pains. And then if we alleviate that neck flexion and we put him in the neck extension, then that could be a positive sign for impingement. And then it rules out the hamstring pathology. The next thing that we have is Brudzinski's and Koenig's test. So have him lay on his back again. And then we'll go ahead and bring his knee up. And then if he has pain with that, we will flex the knee. And then if that alleviates the pain, that's a positive sign for a nerve root impingement. And then for the Koenig's sign, or Koenig's test, we will have him extend again and then bring his neck up. And then that would be a positive sign as well for nerve root impingements. And then if he has pain with that or radicular pain with that, then that would be a positive sign. Now we're moving on to the Valsalva technique or maneuver. So we'll have him take a deep breath and cough. This will be an increase in the intrathecal pressure, and then it causes a pain. If that pain is there, then that could be a positive sign for a herniated disc anywhere in the spinal cord or column. The next thing that we have is bowstrings. We'll have the patient lay back. This is going to test for sciatic nerve tension. We'll have him bring his leg up. If that's pain, then we flex the neck or flex the knee, and then we'll go ahead and push into that sciatic popliteal surface fossa, and then with pressure, if that pain returns, then that'll be another positive sign. Next, we have Milgram's. You'll just have your patient do a 6-inch leg raise, like a core exercise, like that. If they're not able to hold that position, then that would be a positive sign for intrathecal or extrathecal thecal pressure. It could also be a nerve root impingement. So for single leg stance, we'll do the Stork test. First, we will have the patient flex his hip, and then we'll have him extend. If he has a pinpoint pain somewhere in the back, that would be spondylolysis. And then if we add rotation to that, and he still has more pain, then that would be spondylolisthesis. Those are what it's testing for, and that acute pain in one spot is the positive sign. Okay, for Hoover's test, this is when we'll have the patient lie on his back. This one's kind of testing for workers' comp and seeing if they're actually lying about their injury or not. So we'll go ahead and lift both legs up. And then if I feel that pressure coming down on his uninvolved leg, then that means that he's faking his injury. If the patient isn't actually able to lift the leg up, you won't feel that force down on your other hand. Gaslins, however you pronounce it. I'm going to have him side lie. And then I'm going to have him bring his top leg up, stabilize here at the hip, and I'm going to pull back his bottom leg. And then if he has pain in the SI area, that would be a positive sign for SI dysfunction. Next, we'll move on to Gillette's test. We're going to go ahead and palpate his PSIS right there, and then move into the spinous process of L2, L3. Have him flex his hip of the left. And if it would be a positive sign if there's no movement of the PSIS, testing for SI hypomobility. Next test that we have is the supine to sit test. This one's going to test for leg length discrepancies and the position of the hips, pelvic rotations. So I'm going to go to the distal aspect of the medial malleolus, tell him to sit up. And then if these medial malleolus change, then that would be the positive sign. Next we have Piedius. I'm going to ask him to face that way. And then, just like that. Palpate his PSIS. And then we'll have the patient move, flex forward. And then if these are, if they move a lot and they're not equally moving, then that'd be a positive sign for SI joint dysfunction or hypermobility. Next, we have the SI joint stress test. And so for the first part of this, they're both going to be testing for SI joint pathologies or sacroiliac pathologies. So for the first one, we're going to go this way and then push out. We're going to push out for that one, which would be the distraction, and then we'll have him lay on his side, and then I'm going to find his ASIS and then push down on it this way for compression. If either of those elicit pain, then that would be a positive sign. Next we have Ziggers. This one we don't actually do, so you would compress their jugular vein and have them cough after about 10 seconds. If they have increased intrathecal pressure, they could possibly have a herniated disc, and the positive sign would be pain in the lumbar area. And then next we have Hibbs test. I'm going to have him lie prone, and then I want to stabilize here at the sacrum, bring his knee up, apply an axial load of the tibia, and then internally rotate his leg. The positive sign would be pain or radicular pain. If he has problems in his hip area, that'd be more of a lesion, so it could be arthritis or a sprain. If he has problems in the back, that'd be an SI pathology. And then any radicular pain coming down the posterior aspect of his leg would just be sciatic nerve problems. Next we have squish test. And this one's similar to the apprehension test, but this one you'll be pushing downward and in. So like this, grab the ASIS and push down and in. Positive sign would be pain again at that SI joint, and then it depends whether they have pain more anteriorly or posteriorly, and depending on if it's really deep or they point to the back. Next we have spring test. I'm going to have them lie prone. I'm going to find the spinous processes coming down, and then I'll give them a little quote-unquote squish, and then they'll spring. If they either stay down, they move a lot up after you push them down, then that'd be a positive sign, along with if the patient elicits pain by themselves, and then a positive or that tests for hypermobility of the vertebral ligaments. And then we have also scoliosis test, or the Adams test. I'm going to have the patient come over here, bend forward, and then I'm going to use my 2 fingers and follow the structure of the spine, keep on going until he has red marks. It wouldn't hurt, but once those red marks show, I'll have a pattern of his back. We are going to be testing for scoliosis, and a positive sign would be if there is curvature in his back. And then we have quadrants test. Sorry for keep standing and stuff. So we're going to go ahead and have the patient move back and then rotate, but I'm going to be pushing him in the rotation. And then if he has a pain in his back or anywhere on his vertebral column, that would be a positive sign. This could have radicular pain. You could have local pain. The symptoms determine what you want to call the pathology. So if it's really in there at one spot, that would make it more like a facet joint. If it's around the PSIS, then it could be an SI joint dysfunction. And that is all.